Good morning, everyone. Is the audio clear for everyone?
Clear, Dato. Clear.
Okay.
Yes.
All right. Thank you very much. Dr. Nurul, you're here with us?
Yeah, I'm here, Dr. Dama.
Hi. Hi. Okay, so we can, I suppose, begin our session for today. Good morning again, everyone. And thank you for making time on this Friday morning to be with us. So today you will be hearing from our esteemed speaker who will be talking to us about a very important topic. But before that, let me bid you a very warm welcome to our LACU, or Laboratory Animal Care Unit, Faculty of Medicine UiTM's webinar series. And this is the second in a series for this year. We had one last month, if I'm not mistaken, which went down very well. And this is our second session. Our speaker today is our very own Dr. Nurul. So many of you know her, but allow me to introduce her formally. Dr. Nurul is a senior lecturer in the Department of Anatomy from our faculty. She previously has served as the head of LACU from 2018 to 2020. And she also then went on to hold the position of head of department of the Department of Anatomy for 5 years until 2025. So Dr. Nurul is actively involved in teaching anatomy to both undergraduate and postgraduate students, as well as in conducting biomedical research and laboratory animal models. So her background, Dr. Nurul is actually a doctor of veterinary medicine, or veterinarian, and she graduated from UPM, where she also then continued to do her master's in anatomy. After that, she continued her PhD in anatomy as well, but this time from UKM. So research-wise, her research focuses on the protective effects of natural products against drug-induced liver and kidney injury, with expertise in laboratory animal experimentation, of course, histology, molecular biology, and also experimental pathology. Dr. Nurul is actually a member of the Cellular Stress Dynamics, RIG, under the Health and Wellness Renewal for our research interest group. Currently, after having served as the head of LACU some time back, Dr. Nurul is back with us. She's the associate member for LACU since last year. And she hopes to contribute to promote best practices in laboratory animal care, ethical research, and also competency in handling animals and also using them in experimental techniques. Another feather in her hat is Dr. Nurul belongs to the UiTM Care, which is our university level animal ethics committee. So here she will be part of those who actually approve animal ethics. Whenever we want to do research, we apply, and she's part of the committee that actually approves it. Okay, so there's a lot of good things we can say about Dr. Nurul. Before I introduce her topic, just a few housekeeping rules. So please treat this webinar as a discussion session more than a one-way session. So if you are interested in a certain thing, please feel free to give your questions. We will have Dr. Nurul give her talk, and then we will have some Q&A. Hopefully we have enough time, and then we will also we will need you to open the camera for a quick photo session, and then we will also give you the link for the jam latihan and kehadiran, and I'll tell you more about that at the end of the series, so please stay till the end. Okay, so for today, Dr. Nurul will be sharing her expertise in our webinar, which is entitled Anatomy of Laboratory Animals, Know Your Lab Companion. So briefly, she will discuss the importance of understanding laboratory animal anatomy in supporting high quality ethical and reproducible biomedical research. So please join me in warmly welcoming Dr. Nurul Raudzah to give her talk this morning. Nurul?
Okay, thank you so much, Prof. Dr. Damayanti, for very kind introduction of me. Panjang tu kan, it's lengthy one. Alright,
It's a
okay,
good to share.
so allow me to share my slide. Okay, so I hope that you're able to see my screen.
Yes, clear.
Alright, okay, so alright, okay. So Alhamdulillah, so everybody can see my screen. Bismillahirrahmanirrahim. Assalamualaikum and very good morning to all participants. I can see LACU associate members as well. Other than AP Dr. Damayanti, so we also have Dr. Wan Rafika. She's expert in mosquito research, our own LACU associate as well, while our head of unit and the other member will be joined shortly. Right, so without further ado, as mentioned earlier by Associate Prof. Dr. Dama, the topic for today's webinar series, second series of LACU is Anatomy of Laboratory Animals, Know Your Lab Companion. But while I prepared my presentation, so I would like to add on a little bit to my topic for today's webinar. In order for you to know your lab companion, I mean the anatomy of laboratory animals, you're able to understand the anatomy. In order to understand the anatomy as well as to improve the animal welfare, and of course, in order to get a very quality research and scientific reproducibility, so means that your lab mate or your colleagues can reproduce your research methods, etc. So the topic for my today's presentation is Anatomy of Laboratory Animals, Know Your Lab Companion, Understanding Anatomy to Improve Animal Welfare, Research Quality and Scientific Reproducibility. I'm Dr. Nurul. Okay. So this is an ice-breaking session. Okay. So when you start this lab, very cute, tiny little lab, okay, I want to ask you one question. So would you perform a surgical procedure on someone without knowing their anatomy? So you can answer this. So I do hope that most of your answers will be no. Okay, so means that you doesn't want someone that doesn't have the anatomy knowledge to perform a surgical procedure on you. So it applies similar to our lab animals. So means that we need to know their anatomy in order for us to perform the laboratory or standard operating procedures that we want to do in our research work. So why we should learn anatomy of the laboratory animal? Okay, so by learning the anatomy of the lab animal, so we able to understand the anatomy will help us in choosing the correct procedure. For example, you want to do the oral gavage, you need to know the location of the esophagus, you need to know the location of the trachea. Trachea lies in front of the esophagus, etc. So by understanding the anatomy, it helps us to choose the correct procedure as well as in minimizing the injury. Okay, so we're able to minimize the injury. Of course, by understanding anatomy, it also helps us to collect appropriate tissues. For example, you want to collect liver, for example. So you need to know which lobes that you are going to collect soon during tissue processing or tissue harvesting and later on after you sacrifice the animals. Okay. So after that, final result is hopefully we do hope that by doing the research work, we're able to reduce failed experiments, and then we have to repeat again. All right. So we doesn't want to go go all again. Okay. For example, like 3 to 4 weeks research work, so we doesn't want. So we want to improve the reproducibility of our research. So that's why it's very crucial, it's very important to learn anatomy. So we should be able to learn the anatomy of our lab animal. All right, so I do hope that by end of today's webinar session organized by LACU, you're able to recognize major anatomical structures, especially this is for mainly for PG students. You're able to identify anatomical landmarks, especially used in biomedical research. You're able to relate anatomy to common laboratory procedures. And of course, by end of the day, you want to appreciate the role of anatomy in supporting the 3Rs. 3Rs is the guiding framework for the ethical animal research. Okay, it consists of the replacement, reduction, and refinement. Okay, I'll mention a little bit on the regarding the 3 Rs at the end of my today's presentation. And of course, by end of the day, we want to improve the competency. We want to improve our own competency in animal handling as well as tissue collection. So similar to PT students as well as for the supervisors, we want to improve and enhance our skill in animal handling as well as in tissue collection. All right. So for the laboratory rat, okay, laboratory rat, our rat farm, it doesn't matter whether you choose to use the mice, okay, mouse, or you want to choose rats, okay, according to your proposed research work, for example. The lab rats is not just an animal, not just a model, rather a living research partner. Then I do hope that maybe we can include in our acknowledgement for students' acknowledgement, for example, in their thesis, kan? So we can include, rather than we say thank you to our family, friends, of course, supervisors, supervisory committees, lab staff who involved directly or indirectly in completing a PhD, master's thesis. So we may include a group of rats, okay, or a group of mice, rabbits, for example, who involve, which involve very actively in doing our research. Okay, so the laboratory rat is a living research partner. All right, so let's proceed with the laboratory animals in biomedical research. Okay, there are a few examples. For example, mice, rodents are widely used animals, lab rats, lab animals in biomedical research. Okay, we also we also have some students, researchers who are doing rabbits, for example, mainly for the cardiovascular research. We also have some research. Okay, they doing guinea pig, hamster. Okay, so now current trend is, I think most of the researchers, they want to embark on using a zebrafish. Okay, and also some researchers, Westerners countries, because when I search in Google Scholar, then they did doing their research in horses, frogs, okay, as well as in primates, monkeys, macaque monkeys, but that one is controversial, still under ethical research, okay. But the most widely used lab rats in our country is mainly rodents, which are the mice, rats, as well as the guinea pig and the rabbits. So how well do you know your lab rats? How well do you know your lab rats? Okay, by looking at this picture, I do hope that you're able to know which one is anterior, which one is posterior, which one is cranial, which one is caudal, which one is inferior, which one is superior. So how well do you know your lab rats? Okay, for those involved in bone research, for example, you need to be able to identify all the bones. Okay, so this is the skeleton of the rat. For example, you're involved in research bone metabolism, for example, so you need to collect a femur. So you need to know which femur that you want to collect, whether right femur or left femur, or maybe your supervisor asks you to collect harvest tibia or fibula, for example, and then you need to know where is tibia, fibula located, whether it's in forelimb, whether it is in hind limb. Okay, so this anatomy knowledge is very crucial, it's very important. Okay. So by looking at these dissected rats, okay, so I do hope that, okay, for PT students especially, so you're able to at least identify 5 organs, okay, from these dissected specimens. You can't really see the heart, you can't really see the lungs because it's within the thoracic cavity. So this is the abdominal cavity and this is the pelvic cavity. So you're able to see most of the abdominal cavity is occupied by the liver. So this is the liver. So if you're able to identify at least maybe more than 5, then it's good already. So it means that you can pass your anatomy knowledge, okay? So as I mentioned earlier, anatomy is very crucial, very important. It's better to have good knowledge of anatomy because good anatomy leads to good researcher, competent researcher, and finally you're able to produce good research. Okay. So in order to get to know your lab companion, okay, so as I mentioned earlier, so this webinar is mainly focused on the rodents, okay, which are the mice as well as the rats. So why are they preferred lab animals? Okay, as we know that the laboratory rat is very versatile model for the biomedical research. So if you can see that the characteristics is very docile, easy to handle, okay, and then it's for rats, larger, they have larger body size, almost about 500 grams. And they also produce rapid PAPs. Okay, so this is very important for those who involved in reproductive research. Okay, so because they need to shorten the timeline, so once after each collection, so they're able to collect about 6 to 12 PAPs. Okay. So other than that, okay, so the rats and mice, they have short lifespan, about 2 to 3 years. Okay, so you need to manage your time properly so that you're able to complete your research work maybe in first or second years of your studies. Okay, so for the rats, okay, it is very versatile because it composed of well characterized anatomy and physiology. More or less, it's quite similar with the human. Okay, of course there are differences in terms of sizes, the rates, for example, but somehow more or less. So that's why when we present, normally when our student present, for example, so we tend to say that, okay, this project is mimic to human. This animal model is mimic to human. So somehow you need to very carefully mention, because there are some differences in terms of comparing between human as well as your lab animal. So other than that, the rats as well as mice, they are highly adaptable. Okay, so there are a few advantages to the researchers when they prefer to use rats and mice in their lab. For example, suitable for training, routine handling, and experimental procedures because of the bigger size, for example, in rats. So for the blood collection, it's quite easier compared to mice, because mice is smaller a bit in size. So efficient colony maintenance and breeding program, okay, this is mainly for those who are doing repro research. And for example, rats ideal for aging project, chronic disease, as well as long-term studies. And of course, there is a reliable, reproducible, and comparable across studies. So that's why rats, they are preferred lab animal, versatile model for the biomedical research. Okay. So now, these are few common diseases whereby most of the researchers, they choose to have rats, okay, in their research. For example, cardiovascular diseases in terms of the hypertension, heart failure project, neurological disorders, Parkinson's, because of the aging rats. So diabetes, obesity, drug toxicity, pharmacology project, liver and kidney injury models, as well as the cancer research. So these are the common disease models whereby most of the researchers choose and pick the rats and mice in their studies. So there are some interesting facts that I would like to highlight. For example, rats, they cannot vomit. Okay, so this making proper oral gavage technique essential because they don't have the vomiting reflex. Okay, so this is one interesting fact for rats. Rats do not have a gallbladder, which is present in mice and humans. Okay, this is one interesting fact that you need to know. I remember when I involved in LACU a few years back, and one student approached me and then mentioned, "Doktor, kenapa saya cari gallbladder but I cannot find gallbladder in my rats?" And then okay, so means that your rats do not have a gallbladder, so that's why you couldn't find gallbladder. So okay, so maksudnya salah, and then he need to go back and check with the supervisor, sama ada nak tukar, so sometimes earlier discussion with the supervisor is very crucial. So means that you need to be able to betul-betul baca, thorough research, so which one is the best animal to proceed before you start your animal work. So of course, rats rely more on their sense of smell rather than vision. Okay, so rats are highly social animals and benefit from appropriate social housing and enrichment. So this is also one of the reasons why the neuroscience researchers, they normally use rats, because of the highly social animals. For example, when we do open field tests for the neurobehavioral research, as well as the all other neuroscience projects. Okay, so other than that, because of larger blood volumes allow repeated blood sampling with less technical difficulty than mice, so that's why rats research applications is wider compared to the mice. And please bear in mind that there are a few interesting facts concerned with the rats. Okay, so this is about the comparison of the rat and mouse, where we can see that rat has larger body size, easy to handle, better for surgery and repeated sampling, for example, and very excellent for the toxicology as well as the pharmacology. But you need to bear in mind that there are few interesting facts, okay, with regard to the rats, okay, whereby for mouse, it's smaller economy, okay, very economy, is lower housing cost, because in rats, I think last time I checked with LAFAM, if I'm not mistaken, one rat is about 28 ringgit, so it's about quite expensive, okay, if for example, like you have to at least have 5 groups, so maybe one group is about 8 ringgit, 8 rats, and then one rat is about 28 ringgit, so means that you need to calculate that, and I think it's quite expensive nowadays, okay. So for the mouse, extensive transgenic model is very good for the mouse, preferred for genetic studies and ideal for molecular biology. And so this is the interesting fact. So mouse, human, so gallbladder are present in both species, but for rats, okay, it is absent. Gallbladder is absent in the rat. So these are the rat versus mouse comparison table, that some interesting facts that you need to monitor, that you need to observe in choosing the best animal that you want to use in your study. All right, so moving on to the anatomy of the lab rats, okay, so as I mentioned earlier, so this webinar session is mainly focused on the rodents, okay, which mainly for the rats as well as the mice, okay. So previously when I show you my earlier slide, so you're able to know what is cranial, caudal, what is dorsal, what is ventral, what is medial, what is lateral, and what is defined by the proximal, and what is defined by the distal. So you should be able to know this, okay. So for rats, okay, another anatomical direction that we normally use as in human for medical students, they need to know what is cranial, what is caudal, dorsal, ventral. But for those who involve in neuroscience research, for example, they need to know what is defined by the rostral, okay. So once you master this term, okay, anatomical directions, cranial, caudal, so you're able to start your animal work. It's very important because you need to know the location, you need to know the position. For example, trachea lies anterior to the esophagus. If, for example, you doesn't know what is the definition of the anterior, so it's quite tricky, okay. So better to master this anatomical direction, cranial, caudal, dorsal, ventral, medial, lateral, proximal, distal, as well as the rostral. So let's move on to the systems. So I just focus, this is not going to be comparative between species, but I just took several main systems, for example, respiratory system, cardiovascular system, GIT system, as well as the last system is reproductive system. So we started with the first system. This is the respiratory system. So what is the difference that you can see, that you can compare between human and this is in rat? So what is the difference? You're able to see, okay, the differences is in terms of the lobes of the lungs, okay. So as in human, okay, on our right lung, this is the right lung. So we have 3 lobes, superior, middle, and inferior. But for the left lung, there are 2 lobes, okay, superior and inferior, okay, upper and lower lobes, okay. So means that 5 lobes altogether, 3 on the right and 2 lobes on the left lung. But for the rats, okay, there are 4 lobes on the right and only 1 single lobe on the left side of the rat. Okay, so these are the major differences in terms of the species comparison. Okay, but we want to see, okay, for example, you want to for those who are doing research in respiratory project, for example, you need to know in terms of the harvesting the samples later on after you sacrifice the rats. Okay, so maybe you want to discuss with your supervisor, so which lobes that you want to collect, for example, left lobe, or maybe you want to choose another 4 lobes for the molecular project later on. For example, maybe anterior lobe of the right lung you want to keep for the ELISA kits, for example. Maybe middle lobe you want to keep for the protein analysis, for example. And maybe last one, posterior lobe of right lung, maybe you want to keep this lobe for your PCR analysis, for example. So managing the lobes as well as in order to know, to have that knowledge is very crucial. Okay, so prior to that knowledge, it means that you need to study before you start your animal work. Okay, this is very important. So these are some comparative comparison between species, as I mentioned earlier. So left lung, 1 lobe, single lobe on the left lung in red, as well as there are 4 lobes on the right lung of the rats. Okay, so 2 lobes on the left lung, superior and inferior, upper and lower lobes, whereas there are 3 lobes on the right lung, superior, middle and inferior. So because sometimes we tend to say that our project is mimicking in human study, etc. So I think my advice is for you to understand before you, especially for students, before you go for your viva, so you need to know rather than mimicking, okay, so means that you need to know the comparison in anatomical differences. Okay, this is very crucial because you need to have that anatomy knowledge before you embark on your animal study. So this is, I just want to show you a very interesting respiratory histology. So because I come across this article, so it's showing that microscopic anatomy of the rat and human airways. So we can see there are slight differences in terms of the epithelial lining on the nose, trachea, bronchus, primary bronchus, bronchiole, as well as the alveolus. So we can see, as I mentioned earlier, for those who are doing respiratory research, so you need to know the epithelial lining. So this is the microscopic the comparisons between two species. So second system is the cardiovascular system. It is mainly, majorly, primarily studied worldwide. Okay, why is the rat heart a valuable model for human cardiovascular research? So there are many features in common. For example, heart. Okay, there are 4 heart chambers. Okay, as in human, there are 4 heart chambers: right, left, atrium, auricle, ventricle. So same goes in lab animal as well. So there are many. They are sharing many features in common. However, there are important differences. Okay, so let's see the differences in terms of the heart rate. Okay, whereas in human, the heart rate for the heart is about 60 to 100 beat per minute. So the size is smaller compared in humans, so the metabolic rate is higher, and of course the lifespan is shorter compared in humans. So that's why rat heart is a valuable model for human cardiovascular research. Okay, so similar cardiac structure. So this is one of the main point. Okay, when most of the researchers they go for the cardiovascular system because of the similar cardiac structure. So both species, both human as well as the rats, okay, they have 4-chambered heart, similar valve, comparable coronary circulation, similar cardiac muscle organization. So it is well used for the drug development, whereby it is widely used for the cardiovascular related drugs. And of course, cardiovascular system is very good for the disease model, for the myocardial infarction, hypertension, ischemia, reperfusion injury study, for example. And of course, in terms of the molecular studies, the pathways, okay, which involve the oxidative stress, for example, inflammation pathways, apoptosis, mitochondrial dysfunction, more or less quite similar or comparable between rats and humans. So that's why cardiovascular system, selain daripada the similar cardiac structure, so because of this function, so cardiovascular system is very well known by using rats. Okay, so now moving on to the blood collection. Of course, for the blood collection, there are a few blood sample collection. This is on mice. So there are a few sites, okay, jugular vein, cardiac puncture, dorsal pedal vein, orbital sinus, saphenous sinus, as well as the tail vein. But somehow welfare considerations need to be taken care of, and as well as the requirements under approval from the institution should be considered, okay, for the blood collection. So means that other than you know about the anatomy of the heart, you should be able to know the coronary circulation as well as the peripheral circulation of the blood, because you need to take blood samples, so you need to know which site that you want to go for, whether you want to collect blood from the orbital sinus, whether you want to collect blood from the tail vein, etc. So this is very important. So next system is the gastrointestinal system. Okay, so this is the comparison between human and mice. So you can see that there are some differences. Okay, so first we'll see the stomach. Okay, so this is the 4 parts of the stomach in human. So this is the stomach's human. So there are 4 parts. Okay, the cardiac, the fundus, okay, the body, and the pyloric part of the stomach. But in mouse, there are considered 2 parts of the stomach. Okay, the first part is the non-glandular, which is also called as the forestomach. So the second part is the glandular, okay, so below the forestomach, okay, so these are the significant comparisons that you need to know if you are doing a GIT research, okay. So more or less quite similar in terms of the small intestine, but what interesting fact is in terms of the cecum, okay. So cecum is a blind site in human, okay, hardly separate from the colon, and we can see the vermiform appendix at the bottom part of the cecum. But in a mouse, okay, cecum is quite large, okay, because of the nutrition, because of the nature, because of the ecology of the mouse itself. So the cecum is very large, okay. Of course, it's also known as the fermentation bag, and appendix is hardly separate from the cecum. Okay, so these are some significant differences if we compare between a human as well as the mice. Okay, so we can see the differences in terms of the microscopic or the morphology of the colon. Okay, this is in the stomach and this is in the mouse. Okay, so as I mentioned earlier, it's very crucial to know, for example, you are doing a GIT system, you want to collect the small intestine for intestinal permeability research, for example, you need to know which part of the small intestine that you want to take or collect during tissue harvesting later on. For example, you want to collect duodenum, first part of the small intestine, you want to go for the jejunum or you want to go for the ileum, so you need to know at which measurement, okay, the duodenum, the jejunum, as well as the ileum. So anatomy knowledge for the gastrointestinal system is very crucial as well. Okay, so this is very important. As you can see here, if someone very familiar with the anatomy of the lab rat, so you're able to see cecum. So this is cecum, as I mentioned earlier, it is relatively big in rats. Okay, so this is the function for the cecum is for the hindgut fermentation. So why it is relatively large? Because it's species variation, embryologically. That's how the cecum looks like, and of course it referring to the physiology how the cecum is function, okay, because it's a hindgut for the hindgut fermentation. So for those who are doing nutrition, microbiome research, as well as TGI research, as mentioned earlier, so it's very crucial for you to know this is cecum, whether you need to know you want to collect cecum later on for your tissue harvesting, so you'll be able to know cecum a part of the small intestine as well as the large intestine. So this is also applied when you do intraperitoneal injection later on. So later we go for anatomy in practice. Okay, so this is very interesting as well. Why are mice the most widely used model for pancreatic research? Okay, this is because of extensive transgenic and knockout mouse model. So because for the mice, it's well characterized models of type 1 and 2 diabetes. So that's why mice is the most widely used model for the pancreas research. As well as the short breeding cycle, they are available of diabetes strains for those who are doing research in pancreatic research. So, and then mice also has powerful genetic tools to study pancreatic development and beta cell biology. So basically, for those who are doing GIT research, mainly on the pancreas, you need to know why mice is the most widely used model for the pancreas research. Then you can see this is the comparison between the human and the mice. You can see the macroscopic anatomy of the human as well as the mouse pancreas. So you can see there are few parts of the pancreas in the human. So this is the head, okay, this is the uncinate process of the head of the pancreas. So this is the body and this is the tail. So it looks like a leaf shaped pancreas in human. But for mice, okay, so you can see the variation in terms of the shape. Okay, so it looks like maybe the shape is quite somehow bigger compared to the human. And during tissue harvesting, sometimes pancreas is normally mistaken as fat. So that's why students cannot collect or harvest the pancreas, because of the pancreas is embedded in fat, and then they suddenly, because they want to see the pancreas, and then the students will tend to remove the fat and accidentally remove the pancreas as well. So that's why the anatomical knowledge is very important for you to identify which one is pancreas, which one is small intestine, which one is large intestine. So it's very crucial. Okay, so now moving on to the last part of the GI. So we can see the liver. All right, okay. So as you can see from previous slide, I do mention that rats doesn't have the gallbladder. So this is the mice. Okay, this is the mice liver. So this is the rat liver, and this in human. Okay, so we can see the gallbladder in the mice liver, whereas there is no gallbladder in the rat's liver. So we can see there are few loops. Okay, this is very crucial because when you want to sample the liver, so you need to know which loop that you are going to collect during after you sacrifice the rats. Okay, so the allobated and non-allobated livers share the same internal architecture. So the functional lobular architecture, vascular and biliary conducting systems are similar. However, the relative size and cross distribution of the loops differ. So in human, there are four loops of the liver. So the first big loop is the right loop. Second is the left loop, quite smaller compared to the right loop. And at the back, we have the caudate and we have the quadrate. So there are four loops, anatomically four loops of the liver in human. Okay, so for in mouse, so you can see 4 to 6 loops, okay, as well as in rat, but in rat there is absence of the gallbladder. So it is very important. So that's why I experienced one student approached me, as I mentioned earlier. So he looked for the gallbladder because he used rats, okay, but somehow rats is absent, gallbladder is absent in rats. Okay, so by understanding the anatomy, it's very important for you to know which species that you want to use in your research. Okay, so this is interesting facts. Gallbladder is absent in rat liver. However, it's present in mice. Okay, so there are 6 lobes of the liver. However, there is no clear morphological division of the lobe. So we can see, as I mentioned earlier, there are 4 lobes in the liver: right lobe, left lobe, caudate, and quadrate. So we can see in this image, okay, so there are about six lobes in the rat's liver. Okay, left lateral, left medial, right medial, dorsal right, as well as the ventral right lobe. Okay, this is very crucial. Why? Because you need to be consistent, especially in liver harvesting later on. Okay, so you need to be consistent. For example, maybe you want maybe first batch you want to collect a left lateral lobe, and then second batch of rats you want to collect another lobe, left medial lobe. So it's going to be varieties in terms of the results later on. Okay, so you must be consistent in choosing the best lobe that you want to collect during tissue harvesting, especially in liver, because lobes of the liver is quite it is not 1 or 2 lobes, but about 6 lobes of the liver in the rats. Okay, so this is microscopic in situ visceral surface of the liver in the chinchilla. Chinchilla is one of the member in the rodent family. Okay, so it's about a bigger size of rats rodent, but it's still under a rodent family. So we can see the similarity in terms of these lobes of the liver because it's under the same family. Okay, so if we want to compare, these distributions, okay, in terms of the human liver, if you compare with the rats as well as in human liver, so we need to know there are few segmentation concepts of the human liver. Okay, so the first one is the Hyotos concept. Okay, it's a distribution based on the bile ducts. Okay, so we can see how the liver lobes is distributed. So we can see number 2, number 3, number 4, number 5, etc. So this is how the liver lobes of the liver is distributed based on the bile ducts distribution. Second is the Haley's distribution. Okay, this is how the liver in humans is distributed based on the hepatic artery. So we can see the segmentation of the liver lobe, which are distributed based on the hepatic arteries. So for the Cunard distribution, so it is based on the portal or hepatic vein. So this is very important in terms of the segmentation concepts of human liver. But in animal, normally we just go for each lobe that we want to collect. Okay, so just want to see the comparison, as this one is you need to know because especially for students, because you want to see the distribution because we tend to say that sometimes in livers, researchers tend to say that okay, liver is mana-mana sama saja, okay, but basically it is not because of the distribution is depends on bile duct, hepatic arteries, as well as the portal or hepatic vein. So you need to be careful on this. All right, so last system is the reproductive system. Of course, male and female rat is different with the female rat. So for those who are doing reproductive system, so you need to know the specific whether you want to go for male, whether you want to go for female. Of course, depends on your research project. Okay, for example, if you go for male repro system, okay, you need to know that mice and rats also contain additional accessory sex glands, okay, which are absent in humans. Okay, so tak ada pula tiba-tiba then you kata, okay, I found this, and then you go and see your supervisor, and then you can inform your supervisor, okay, I found this extra accessory sex glands. No, because they contain additional accessory sex glands. So finding this gland should not be interpreted as an abnormal finding of rodents. So this is interesting facts that you need to bear in mind, okay, for the male reproductive system. So we have the seminal gland, prostate, so epididymis, testes. So you need to be able to identify all these traits for the male reproductive system. So this is in female. So of course there are differences in terms of the sizes. Okay, this is the urinary bladder. So this is the seminal vesicle gland. So this is the prostate gland, and this is the corpus gland. So more or less quite similar in terms of the size. Of course, there will be some slightly differences. Okay, so you should be able to know in detail with regard to the organs or structures in this male reproductive tract. So for the female reproductive tract, female reproductive system, so we can see that this is the urogenital system. Okay, this image showing the urogenital system. You can see the kidney. So this is the right kidney, left kidney. So you can see parts of the female repro system. Okay, so this is the ovary. So you can see that ovary is embedded in the ovarian bursa. So on top of this, this is the oviduct. So you can see the ovary within the ovarian bursa. So this is the uterine horn. So there are two uterine horns, okay, and this is the uterine fundus. So this is the cervical region, okay. And okay, so this is the external vaginal opening, okay, later on. So this is the vaginal valve. So this is the, when we see the in human, okay, so we can see the differences. So this is very significant different in terms of when we compare between human as well as in rats, okay. So this is the ovary, okay. So this is the mesometrium, which is part of the broad ligament in human. So this is the uterus, okay. So this is the fallopian tube or uterine tube. So there are four parts, okay. So the first one is the fimbria. It's like finger-like structure, okay, that enclose the ovary. So this is the ovary. So this is the ampulla. So this is the isthmus, okay. So there are four parts of the fallopian tube in humans. So this is the ovary. So we can see quite a significant differences in terms of this in both human as well as in rat. Okay, so for those who are doing reproductive, for example, in breeding or testing natural products in reproductive research, so you need identify very meticulous and very thoroughly because you need to know which structure that you want to collect during tissue harvesting and so on. All right, so these are some of the interesting facts for female rat, okay, as well as in male rat, okay, as I mentioned earlier. So the biconate uterus with two uterine horns, okay, it is very significant if you compare in human. So for the male rat, possess large accessory sex glands that contribute significantly to semen production. And of course, rats are excellent models for reproductive as well as the endocrine research because of the estrous cycle lasts about 4 to 5 days. Okay, it's very good, very excellent model for reproductive research. Rats are induced by hormonal cycling, not as in menstrual cycle like in human. So for male rats, seminal vesicles are very much larger compared to human. And in rats, okay, the baculum, okay, it possesses baculum or penile bone, which is unique to many rodents. However, it is absent in humans. So these are some of the significant differences that you need to know in terms of comparing between the female rat as well as the male rat. So, all right, moving on to the last part of the sharing session today. So anatomy in practice, okay. So when you handle and restrain, you need to do it correctly, okay. So correct holding, for example, you need to support the thorax, you need to support the hind limb, okay. You need to support the hindquarters of the rat, okay. So to perform the correct handling, you must avoid excessive pressure on the chest, okay. So this must be uncomfortable to the rat, okay, will compromise its breathing. So you need to secure but gentle grip, okay, so that you able to minimize the stress as well as you're able to minimize the struggling for the rats. So if you do incorrect holding, okay, incorrect handling of these lab rats, okay, stress and fear response, okay, bite or scratch injuries, okay, then somehow your rats or your mice will, you know, fall onto the floor. So we doesn't want that to happen, okay, in your lab animal facility. So also incorrect holding, incorrect handling will cause a soft tissue trauma. For example, your mice or rats fall onto the table or tabletop, okay, fall onto the floor. So we do hope that that kind of incidents never happen in your lab. So respiratory compromise, of course, and as well as this will finally result in the experimental variability. So in terms of animal welfare, this is very important for us under animal committee. So of course, in anything we do, especially which involve the animal, so we need to reduce pain and distress, better animal welfare, as well as safe procedure, and to improve research quality. So handling and restraint is very, very crucial for the lab rats. Okay. So oral gavage, okay, why can gavage fail? We need to know the correct pathway. Okay, we doesn't want to know the incorrect pathway. So that's why by understanding your anatomy, okay, as I mentioned earlier, for example, trachea is located anterior to the esophagus. So you can see this is a trachea. Trachea lies anterior to the esophagus. But for example, because let's say if you don't know the term, what anterior is the meaning of the anterior, so you doesn't know that trachea lies anterior, means that the trachea lies in front of the esophagus. So that's why it's very crucial to know the position as well as the location of this, and then you can handle the animal very well. You can do the standard operating procedure. For example, in this, you are going to do the oral gavage. So that's why can gavage fail? Because you doesn't know. Somehow you you direct your oral gavage in correct pathways. So means that your oral gavage is inserted into the trachea, and then suddenly the animal choke. Okay, then so finally it will result in the complication. For example, reflux, aspiration, tearing of the esophagus, and then the animal will die later on. Okay, so of course we doesn't want this complication. By knowing the anatomy, so means that you able to know your anatomy, you able to understand the location of the trachea, which lies anterior to the esophagus, then you able to do the procedure. Okay, so I don't want to proceed on the procedure because that one you can learn during animal handling workshop later on in October. So, but before you go for this workshop, animal handling workshop, you need to know the anatomy of the lab animal. Okay. So for the injection routes, okay, it's very linked to anatomical landmarks. Okay, for example, okay, there are few injection sites. Okay, IV, intraperitoneal, intramuscular, intrathecal, intradermal. Okay, subcut injection. Intranasal, intratracheal. Okay, so these are all the injection routes. Okay, but for example, intramuscular, for example, subcut, sorry, this is subcut. You need to know the anatomy of the skin, and then you know how to handle the subcut. Okay, for example, there are 3 layers of the skin. Okay, the anatomy of the skin, it is comprises of 3 layers: epidermis, dermis, and subcut tissue. So means that you know that you punctured into the correct site. So means that you know that your needle goes into the subcut tissue. So then you're able to perform the subcutaneous injection. So this is very important. You need to know the anatomy of the skin. Okay. So same goes to the injection routes. This is IM, intramuscular. Intramuscular is considered as painful injection routes. Okay, intramuscular injection means that you inject the muscle at the posterior thigh of the rats. Okay, so means that you go and puncture this area. So means that care must be taken to avoid the sciatic nerve. So you can see the sciatic nerve is running, okay, along this posterior thigh of the leg of the rat. Okay, so means that you need to know the size of the needle. You need to know the how far you go, how far you inject, okay, the muscles. Okay, so it's not like you are going to poke into the sciatic nerve and then suddenly the rats will be in paralysis. Okay, so we doesn't want that to happen. So you need to be able to know when you do the IM injection, you need to know what are the muscles that you injected. Okay. So similar goes for the intraperitoneal injection. So it's a common route for the parenteral administration of drugs in rodents. Okay, so the most common IP injection is at the lower right quadrant. So means that right lower quadrant. Why? Okay, so the ventral part, okay, the ventral part of the rat's body, okay, it is divided into 4 sections, 4 quadrants. Okay, this is the right upper quadrant, this is left upper quadrant, this is right lower quadrant, and this is left lower quadrant. So the right lower quadrant is the common route for the intraperitoneal injection. Why? Because there are some organs that you need to avoid during the injection. Okay, for example, this is the imaginary line, okay, for the 4 quadrants. This is the right upper, this is the left upper, this is the right lower, and this is the left lower. So if you go to the right lower quadrant, then you can perform this IP injection very well. But if you target the left lower quadrant, suddenly you inject into the cecum, and then the cecum will be, maybe the fecal contents in the cecum will be leaking out. So once the fecal feces content leaking out into the peritoneal cavity, then suddenly your rat is having peritonitis, means the inflammation of the peritoneum. So we doesn't want that to happen. Okay, and then suddenly once the rat is inflamed, peritonitis kicks in, and then suddenly your rats will be will be dead. Okay, when you check the rats before you're going back home, for example. Okay, so in order for you to know the anatomy, the quadrants for the abdomen is very crucial. You need to know what are the animals under each quadrant. So same goes for the blood sampling. Okay, maximum blood volume, recovery periods, importance of vessel anatomy. Okay, so it's quite similar with the cardiovascular slide just now. You need to know why you want to use a tail vein. You need to know why you want to proceed with the saphenous vein. You need to know whether is it okay to do a jugular vein, and then you need to know cardiac puncture. For example, cardiac puncture is terminal, so means that you want to maybe after you discuss with your supervisor, and then you want to proceed with only one because you want to take blood only once. Okay, at the end of the project, then you need to choose this cardiac puncture. But for example, you want to do repetitive blood sampling, then you have to go for tail vein, for example. So you need to know which vein that you want to proceed for your blood sampling, other than maximum blood volume as well as the recovery periods. So you need to know how much period that your animal needs in terms of if you do repetitive bleeding, and then it's quite tiring, painful, distressful for the animal, you need to check on that as well. This is very important, especially when you apply for the animal ethics, when you submit for animal ethics application. So for the sacrifice necropsy, okay, opening sequence is very important. So you can see that how this researcher is meticulously dissected the skin. So means that you do a very small incision, okay, just do a nick, okay, on the linea alba. So this is the linea alba, imaginary line for the linea alba. So this is your direction of the dissections. You can see that the peritoneum is still intact. Okay, this is what we want in doing the necropsy. Okay, sometimes we know that normally we doing the sacrifice period, we want to make it faster. Okay, mungkin sebab dah petang, so you want to make it faster, and then you suddenly just poke through to the peritoneum, and then suddenly the peritoneal fluid oozing out, okay, from the incision that you made earlier. So I think we try to avoid that, okay, because we want to see, you can see that how meticulous this researcher opened the abdomen, and the peritoneum is still intact, okay. So, and then after that you cut the abdomen, you cut the peritoneum, and then you expose to the peritoneal cavity, and then you can see your organs that you want to collect, okay. So you can see liver occupies upper part of the abdomen, so you can see your small intestine, right small intestine, so we can see the bladder, so we can see the fat, okay. So this is the sternum. So technique in doing necropsy is very crucial, okay. So common mistakes, normally sampling wrong lobe, for example in liver, that's why consistency matters, as well as poor fixation. For example, you want to go for lung, and then if you compare right lateral lobe of the lung on the right side compared to one single, and then the fixation matters, because the duration of the fixative material to remain, to pass through into the lobe is very crucial. So Another one is the misidentification. For example, you want to collect adrenal glands or suprarenal glands. Somehow adrenal glands, okay, which are located at the superior pole of the kidney, and then you suddenly remove the fat on top of the kidney and accidentally you remove the adrenal or suprarenal glands altogether with the fat. Why? Because the adrenal glands or suprarenal glands, they are located on top of the kidney together. They are embedded. Okay, it is embedded in the fat of the kidney, on top of the kidney. So that's why when you remove and then suddenly you are going to lose your adrenal glands, for example. So misidentification is a common mistakes we do as researcher, normally students, okay, doing following necropsy. All right, okay, so anatomy, the significance of the understanding, okay, your understanding of the anatomy as well as the 3 R's, okay, this is the 3 R's framework, replacement, reduction, and refinement. So for the replacement, we need to utilize alternative methods, okay, in order to replace the use of the animal subject. Okay, somehow maybe you want to proceed with the cell culture instead of doing the animal, or maybe you want to doing animal in smaller number of rats, for example, and then you add on cell culture. Okay, so this is about the 3 R's, okay, the replacement. Second is the reduction. Reduction means that use the minimum number of animals required to achieve significant result. This is very crucial because in animal ethics committee, normally panel we ask you why you want to use 10 rats instead of 8 rats or instead of 6 rats. Okay, so that's why calculation for the rats number is very important. You need to calculate your rats number very meticulously and then before your presentation. So because we proceed with the 3 R, okay, replacement, reduction. Third R is the refinement. So means that we employ better techniques to enhance animal welfare as well as data accuracy. Of course, we want to have a significant results by end of the day. So we need to employ better techniques as well as to enhance animal welfare, as I mentioned earlier. So by knowing your anatomy, by understanding your anatomy, by having competent skills, okay, by knowing your anatomy very well, so you're able to proceed or you're able to perform better SOP, better procedure. You're able to perform intraperitoneal induction, for example. You're able to perform oral gavage administration, for example. So by having that, so means that you're able to make 3 R is you're able to produce ethical 3 R as well as come up with a high quality research. Okay, so high quality biomedical research, the 3 R ensure that scientific data is both robust and ethically sound. And of course, end of the day, we want to be responsible and ethical practitioner, or we want to be responsible and ethical researcher. So these principles promote the responsible advancement of understanding in anatomy and biomedical knowledge. So, all right, so I add on some case studies that I found, of course, based on my experience when I did my PhD, I also did some mistakes, okay, and I think every researcher as well as every student, we learn along the way, so we also did some mistake, okay, of course, mistakes is not for us to fail, okay, so mistake is for us to correct what we did wrong, okay, what went wrong, okay. So for case 1, a PG student accidentally punctured the bladder during the IP injection. So what happened? So how could anatomy have prevented this? Okay, so as I mentioned earlier, you need to know what are the organ structures behind. Okay, so means that you need to avoid the midline. So this is the imaginary line. Imagine this is the imaginary line. So there are 4 quadrants: right upper, left upper, this is right lower, and this is left lower. So you should be able to inject IP correctly. Okay, so means that if these students, okay, punctured the urinary bladder during IP injection, so means that the injection is somewhere near the midline. Okay, so this is the bladder, this is the seminal vesicle, this is the prostate gland. So maybe this student punctured, so means that he pointed the needle at the midline or slightly near to the midline, not within the quadrant itself. So and then this is the results. Okay, so in order for you to understand your anatomy, then you're able to do a very ethical procedure. Okay. So case 2, this is with regard to the sample collection. Okay, so after tissue processing, histology slide show collapsed alveoli, distorted architecture, and poor microscopic detail. So what went wrong. Okay, so why is that so? Why this happened? Okay, lung histology is unusable, and then you have to repeat the same animal framework. Okay, so we try to avoid this. Okay, so means that you need to do thorough reading, okay, prior the animal work. Okay, so means that in this case, lung histology, prior for lung harvesting, you need to know the inflation fixation technique. Okay, so means that you need to inflate the trachea before you collect the lung and put into the formalin. Okay, so of course, thorough reading, meticulous research on previous technique, and of course, you need to attend the animal handling workshop in order for you to know so how you are supposed to collect lung. Okay, so this is one of the examples case studies. Okay, wrong fixation as well as poor anatomical understanding. So for third case is about different researchers sample different liver loops from each animal. Okay, as I mentioned earlier, consistency matters. Okay, consistency matters which liver loop was sampled. For example, because we know that, for example, let's say if you doesn't have much anatomy knowledge for liver, for example, and then you thought maybe rats having the same liver lobes as in human, okay, because human we have 4 liver lobes. Let's say you go for the rat lobes and then you just choose randomly which lobes that you want to take on. So in every sample or tissue collection, you need to be very consistent. So it means that you take for the liver left lateral lobe, and then for next batch, and then you take left lateral. So by doing that means that histological examinations, if you are not consistent, so means that you are going to have variability in your results, and of course the results are difficult to interpret. Okay, so then makes histology inconsistent. Okay, so researcher cannot find adrenal glands. Okay, last case 4, case study 4, researcher cannot find adrenal glands. As I mentioned earlier, okay, so we can see adrenal gland, very tiny gland. Okay, so you can see this is kidney, and this is right adrenal gland. So that's why students normally miss the adrenal gland. For example, they want to take adrenal glands for endocrine research. So somehow students mistakenly commonly mistake the adrenal gland as fat. And then when they remove the fat, suddenly they accidentally remove the adrenal gland as well. So you need to know the adrenal gland is embedded within the fat. So it's very important for you to know the anatomy. So after all, anatomy is very crucial and very important before you do your animal work. Not before you start collecting your samples, but before you go and see your supervisor. So you have to have that anatomy knowledge. Okay. So anatomy, the foundation of ethical and reproducible research. You need to understand the laboratory animal anatomy is not just a technical skill, it is compulsory for ethical research. Okay, so the knowledge foundation, we need to know our animal and we need to know their anatomy. Okay, so we need to know our procedures and in order to avoid common procedural failures. Okay. So of course, this going to be incorporated with the respect, welfare, as well as the 3R, okay, refinement, reduction, as well as the, of course, we need to refine techniques to minimize injury, reduce number of animals, and to produce reproducible science. Okay, so competency begins with anatomy because every laboratory animal deserves a competent researcher. So this is just to promote after what I've mentioned just now. Hopefully it's going to be meaningful sharing on the some major components of my talk just now. So just want to promote animal handling workshop. Okay, will be organized by LAFAM in October. So after you have this anatomy knowledge, now of course you need to study later on. Then after thorough discussion with the supervisors, and then you can go and register for the workshop. Okay, to learn the techniques. Okay, so last but not least, when we understand the anatomy of our laboratory animals, we not only improve our science, but we honor our responsibility to the animals that make scientific discovery possible. I think that's all. That's my last slide. Thank you so much for listening, and thank you so much for joining me for today's LACU sharing session. Thank you.
Okay, thank you very much, Dr. Nurul, for a very interesting and informative talk. Certainly, you have made it very clear to us how anatomy is definitely the foundation to ethical and well-planned and reproducible research, which will then contribute to good results that can be used, for the benefit of advancing the knowledge in our field. Thank you for that. We now open the floor to questions. We have one now from Zul. He says, during tissue collection for histological or metabolomic analysis, is there a recommended order to collect the organs to reduce sample degradation?
Okay, Doctor. Sorry, this is from Encik Zul. Okay, so during tissue collection for histo or metabolic analysis, is there recommended order to collect the organs? First, you need to know your organs. For example, recommended order to collect the organs to reduce sample degradation. Okay, for example, you want to take abdominal organs, or maybe you want to take heart, for example. So I think there is no specific order to collect the organs to reduce sample degradation. Okay, because first you need to know what samples that you want to take. Maybe so you want to take liver samples. Okay, so you need to know which lobe of the liver that you want to put into the formalin. So I think because as soon, of course, when we do the necropsy, so we need to collect as soon as possible. Of course, we need to know what are the samples, organ structures that you want to collect, that you want to harvest. I think there is no direct, recommended order to collect the organs to reduce sample degradation, but we need to do it as soon as possible after we sacrifice the rats, after we, in order to, because once you make it longer, so means that the sample will be degraded. So it is not good for the protein analysis, for example. It is not good for the tissue processing later on, as well as in histology pun, somehow we had issues when we, but normally, like we suddenly left the animals stranded macam tu kan. So we normally straight away do the necropsy in order to reduce sample degradation. For me, from my opinion, there is no recommended order, but we need to collect as soon as possible after sacrifice. I do hope that it's answer your question, Encik Zul.
Yes, you said okay. Thank you. We still have a short amount of time. If anyone would like to ask a question, you can ask Dr. Nurul directly, or you can.
Salina, there's one question, Prof. Dharma. What is the recommended way to store mouse organs for later processing? Should they be kept at -20? Okay, so this one is you need to know, as I mentioned earlier, you need to know what are the parameters that you want to look. Okay, for example, -20, I think -20 is you do the necropsy. Okay, you collect a tissue, you harvest a tissue today, the -20 is not for longer period kan. Kalau -80, you can keep that for longer period of time, but not long as, for example, 1 year or 2 years, okay. Because time management is very crucial in doing research, okay. So means that, for example, you can, 100 minus 150, okay. So it depends, some samples, I put it in a simplest way. Kalau kita nak cepat, so kita letak dalam -20. If you want to like hold sekejap, maybe we can put in -80, or maybe because let's say kalau there are a few parameters that you want to process, so maybe first, second parameters, and then you can put that sample into the -20 freezer, and then kalau you want to make it longer, you nak sediakan yang ni, then you can put in -80 degrees, but not for longer period of time, because I think that's, for example, as I mentioned earlier, for Encik Zul tadi tu, kalau kita nak buat tissue protein, so protein will degrade kan, so I think it's sample storage tu kena betul-betul lah. So ikut timeline as well as kita nak proses yang mana. Okay, thank you Dr. Nasakina. Okay, platform workshop. Okay.
Dr. Nurul. Hi, Dr. Nurul.
Hi.
Thank you again for the great presentation and promoting our LAFA workshop. I have few questions if we have some time. The first question is just out of my curiosity. Can you explain why, what are the advantages or disadvantages of having more lobes or lesser lobes in lungs and also liver? I just wonder why we have more lobes and why we have lesser lobe on right and left, or difference in across the species. So and then the second and the third one quite similar, because we conduct the workshop. So if the student doing the oral gavage and accidentally, because we don't know whether it enter into the esophagus or the trachea, but if we see some bloody discharge from the nostril, is this considered an fail oral gavage? That's the second one. And the third one is that if we do an intraperitoneal, what will be we expecting to see once we cut open the abdomen? Are we going to see some hemorrhages on the surface of the intestine or what? I think that's all. Thank you.
All right. Okay. So I answer your first question. You asked about any significance in terms of having many lobes of the liver. So basically, functionally, it's similar. Dia sama je. Functionally similar. It's because of the embryologically during the development process. Okay. So that's why it's due to the evolution of that species. So that's why rats having 4 lobes on the right and 1 single lobe on the left, while humans having 3 lobes on the right and 2 lobes on the left lung. Okay, evolution and embryologically. So it's like that. Okay, functionally it's more or less similar. Function sama saja. The bronchopulmonary segment also similar. So that's how it goes in terms of the, there is no specific or significant differences in terms of having 4 lobes instead of lung. Okay, that's because of the morphology, because of the evolution, because of the embryologically originated. Okay. Second question is when doing the oral gavage and then you saw some bloods bleeding. Okay. So sepatutnya when we do oral gavage, there is no frothy. Okay. So means that if frothy, animal is struggling and then we know the animal is already in painful state. So means that it is not passed through the esophagus. It's maybe inserted into the upper part of the trachea because of the aspiration. Okay. So once kalau the oral gavage is inserted nicely into the esophagus, so means that animal is your rats is comfortable. So means that of course masa awal tu you can at the initial part of the process tu you can feel like rats is having apa tu
Struggling
struggling kan but somehow when you pass through the esophagus so it's already relaxed because it's because the size is smaller compared to the esophagus kan then kalau you rasa macam you tak boleh nak pass through so means that you are not in the it's already in the indirect pathway, indirect cause. So means that you dah masuk trachea. That's why for the maksudnya dekat apa dia punya nose kan, nasal cavity semua affected kat situ. So I think I do it's answer your question. The third one is about the apa tadi? Third one?
The intraperitoneal once we cut open the animal.
All right. So intraperitoneal. So that's why as I mentioned earlier, it's very crucial for you to choose the best size of needle. So means that you doesn't puncture the intestine. So maksudnya kan ada size kan 26, saya don't remember dah lama tak buat 26 lah yang paling kecil kan 26, 25. Yes, 26, 25. So means that you must choose the right size of needle. So means that you tak masuk ke dalam. Somehow students normally akan poke into the intestine and then somehow kalau yang macam ganas sangat tu tak boleh lah sampai panjang sangat kan dia punya needle kan. But choosing the right size of needle is very important. So means that you are not injected. Okay, so means that you are not injecting your needle into the intestine. Okay, once injected, let's say kalau injected pun and then okay lah sebab IP kan. So then dia maksudnya kita buat sekali je kan. So kalau ada ni pun dia tak, I mean it is not really punctured through the whole intestine. Okay, so choosing the right size of needle is very important for.
We supposed to not to see any kind of hemorrhages on the intestine lah kan?
No.
Thank you, Doctor. Thank you so much.
All right, thank you.
Thank you very much. Maybe Dr. Nurul, I can ask you just one last question for
Sure.
today. So, Nurul, so based on your own research experience using lab animal models, maybe you can share with us one practical lesson or anatomical insight that has significantly improved the quality of your experiments, like your own research-wise.
Okay, susah nak jawab soalan ni, tricky question. Okay, I think because we experience as PhD students before 10 years, 15 years, okay, back. And of course we experience as supervisors, being supervisors. So I think the first one, in terms of supervisor students, I think the main lesson that I learned throughout my journey, I think we need to do thorough research before we start the animal work. Is that thorough research in, for example, because I experienced the case studies too, I punya case studies. Because, I mean, for example, because my area of interest is drug-induced liver injury. And then I collected different lobes, I mean, not consistent for every batch. Okay, and then because suddenly kita rasa macam okay, so liver is same. Okay, so liver is similar. So rather than whole liver is okay, rather than left lateral, right middle, left middle, and then I collected the inconsistent lobe. Okay, and then there is, it's not very near. Then my supervisor taught me, okay, you need to be consistent. You need to choose which lobe that you want to choose. Whether you want to choose left lateral, and then you, throughout your animal work, you need to be consistent. Okay, so that one, first experience, first lesson that I learned throughout my PhD, and I also share this with my students. So means that you choose because there is no specific reason in choosing left lateral, and there is no specific reason in choosing right lateral, for example. But we know that liver, because we want to see, of course, it depends on what are the parameters that you want to start after that lah. For example, my work is mainly on the histology, immunohisto, EM, and then I did some on the protein, gene. Okay, so it's not, not very, not focused on the hepatic distribution, so it doesn't matter. So, but try to be consistent throughout your research work lah, especially in tissue harvesting, because of course, SOP, the procedure is very important. It means that you do the procedure very well, and then you are going to get the organs. The organs is okay, and of course, we plan to get significant results after all. So I think lesson learned from my experience, and of course I'm doing now with my students, we need to do thorough research. Baca meticulous work, walaupun kita tak buat lagi, but you need to be consistent and then you stick. Okay, so maksudnya you want to choose for left lateral and then you go for left lateral throughout your research. I think that's very important lah. The planning, of course, in research, Prof Dama lagi hebat daripada I. Maksudnya we need to do proper planning, and then we need to do proper reading lah.
Yes, I agree. Very, very true. Thank you so much, Dr. Nurul. On behalf of LACU, I would like to thank and invite the audience to join me to thank Dr. Nurul for her excellent presentation, and also the very valuable sharing in today's webinar. I think knowledge that she has shared is very crucial and important. She's also shifted our knowledge. Shifted our knowledge, like our mindset really to consider the animal that we are working with also as part of our research partner, whose well-being is really important to consider for reproducibility and good ethical and high quality research. So thank you so much. As a token of appreciation, we will be emailing you, Nurul, with the e-certificate. And before we end today, may I invite everyone to please switch on your camera so that we can take a group photo, just to record and remember this event today. Shortly, we will be sharing the attendance link and also the feedback form. You can fill it up either by scanning the QR code, or you can use the link that will be put in the chat box nanti. And for the UiTM staff, if you're eligible for training hours, we will include that, but only for those who complete the attendance and feedback. And for the other participants, you will receive your e-certificate as well. So please make sure to submit your form before you leave lah. Okay. Do we have the photos taken already? Maybe I can ask the LACU staff to help me with this. Okay, so we already have the attendance link and also the feedback link. So please do complete this to receive your e-certificate. Okay, so we have already taken the photographs as well. Thank you very much, everyone. I really appreciate. Sorry, we ran a bit extra time, but I think it was very well spent, the extra time. So we conclude our webinar today. Please join us again for the next LACU's next webinar, which will be announced in the coming months. Thank you, everyone, for your participation, and hope to see you again soon. Have a good Friday and then a weekend. Thank you. Thank you, Nurul, as well. Thank you, LACU and the organizers. Bye, everyone.
Thank you.
Also, for those who missed the talk, the LACU recording, the recording of this talk will then be uploaded onto the LACU website. Yeah. So if those who missed any part or you want to revisit the talk, please feel free to go there and have a look at the video recording. Thank you.